I'm April Cummings, and our focus is lung cancer. We're talking with Dr. Dennis Tishko from Broward Health International. Thank you for joining us.
Glad to do it.
This is not the topic that we hear quite so much about these days. Why is that?
That is a really good question. And it's a good question for a lot of different reasons, but especially because lung cancer is a huge problem, much more than many people know. And the fact that we don't know much about it and it doesn't get talked about very much is really disturbing, but this is a wonderful opportunity, so thank you.
So let's talk a little bit about what people need to know. It's a bigger problem than most people realize. What can be done? What can we do?
You're right, it is a massive problem. And the magnitude of that problem is something that a lot of people are really shocked by. Lung cancer is overwhelmingly the #1 cancer killer in the country, in the United States. And we know this year cancer is now the leading cause of death in the United States. So this is really something that should be a target. Lung cancer is killing about 170,000 people a year. And what that means is it's killing 4 times as many people as breast cancer. It's killing 28 times as many people as HIV and AIDS. But yet it's a topic nobody talks about. There's no public interest in it. There's no public forum. But it is so large that it's hard to imagine someone or a family that hasn't been touched by it.
In some way. So what do you want people to know? It is a bigger problem than most people realize, but if you are touched by it in some way, what can you do?
The first thing to realize is that it's a topic, it's a disease that we can approach. And it's a disease that has excellent results if caught early. So for many years, for decades, we've been hoping to have a screening test, some way to check for lung cancer. And a few years ago, that was actually determined. A high-speed, low-dose CT scan, a CAT scan, that doesn't use contrast, so there's no IV, no needles, it's painless. And when we say fast, it's a high-speed 4-second scan that can really save lives. And the results from that are pretty remarkable. What we can see in the latest trial is people who've smoked, high-risk individuals who've smoked, who have the CT scan, have a 71% 5-year survival. People who are not scanned have a 19% survival. So the benefits of doing the CT scan are really massive, and considering how easy the scan is, it's remarkable that we're just not scanning as many people as we want. In the United States, we're only barely scanning 2% of the people. So that gives us a huge opportunity to do remarkably good work.
So screening like this is really important.
It's absolutely vital, and it's the only way we have to catch this disease early. There is no blood test for lung cancer. No matter what you read or hear about, there is no blood test for lung cancer. The only way to catch it early is with a quick CT scan. So getting that message out, and even if people don't smoke themselves, if they've never smoked a day in their life, chances are they know somebody who has. There's a family member, somebody they love, somebody they care about, really needs to know about this. So even if the information doesn't directly affect you, it probably affects somebody you care about.
So this is not particularly invasive, not invasive at all.
Not invasive at all.
It's easy to do. The big issue is just making sure that more people know that it's out there, and that by taking advantage of this, you really can improve your survival rates incredibly.
Exactly. And what we see when the lung cancers are caught early is that we can do something about them. And the thing to do is get the cancer out. So for many years, we've been seeing cancers coming in later and later. Those are very difficult to treat. But cancers caught early, small cancers, when they're removed surgically, long-term results are excellent. 95, 100% 5-year survivals. When we talk about cancer, we talk about 5-year survivals, just because that's a convenient time to sort of standardize against. But seeing 95 or 100% 5-year survivals, I think really surprises people. They may not know that an early stage lung cancer can be cured with surgery. And that's really grounds for optimism. People should be saying we have a bad problem that has an excellent treatment. if caught early.
So I'm going to throw one last one at you because there's been so much talk about vaping lately, and there's the Centers for Disease Control are doing an investigation. Do you have any thoughts on that, on what you're seeing right now?
Yes, and we have to separate out what we mean by trouble. We know for lung cancer it takes 20 years for a cancer to develop. So when we're talking about vaping, which is a pretty brand new topic, we can't really speak with the history that we have for something like lung cancer. But we know clearly that combustion, burning things, produce chemicals that cause cancer. That's really pretty much the mechanism with smoking, is the burning material creates the chemicals that cause the cancer. And vaping is basically burning material that you're inhaling. So it's not much of a scientific stretch to say combustion in any form is bad for lungs. What we're seeing at the CDC are actually pneumonias and inflammatory changes in the lungs. But I think it is a very ominous thing to see this early in a product. So there is no safe vaping. There is no safe product. And no matter what you want it to be, it's a bad and dangerous idea. Seeing this much disease this fast should get everybody's attention.
Thank you so much for talking with us.
Glad to do it. Thank you for having me.